Welcome back to the Medical Store channel. I am Victor, your sole host, and today we are going to be looking at hypothyroidism. Okay, this is one of the series of the videos about the thyroid gland and its hormones and their effects. So if you are watching it for the first time, you can go back, review the thyroid gland and the hormones it produces, and then you will have a better understanding of the video that we are making today. So let's talk about hypothyroidism. So what is hypothyroidism? Hypothyroidism is a condition whereby someone has reduced amounts of thyroid hormones, and therefore even the effects of the thyroid hormones are going to be reduced in this person. But before we understand hypothyroidism, let's take a few minutes and we understand the physiology of the thyroid gland briefly. Now, we said that the thyroid gland has two lobes. It has the left and the right lobes, and these lobes have cells that we call the follicular cells. And these follicular cells are the ones that produce or that manufacture the thyroid hormones, which are basically T4 and T3. And therefore, we also said that T3 is the most active hormone of the thyroid gland. And therefore, always T4 is converted back to T3 when it reaches the target organs so that it is able to exert its effects. And also we have to understand that the hormones of the thyroid gland do not have specific areas in the body. Because, for example, all nucleated cells in the body are affected by these hormones, okay? And then let's look briefly about some of the effects of these hormones. On cells, or what we call the nucleated cells, we find that these hormones affect glycolysis. They also lead to increase in glycogenolysis. They also lead to increase in lipolysis. So as a result, all of these ones increase what we call the metabolic rate. And of course, as you increase the metabolic rate, you are increasing heat production. Okay? Heat production. On the heart or on the cardiovascular system, we find that these hormones are responsible in maintaining or increasing the heart rate, also increasing the force of contraction. And of course, if you increase the force of contraction, then you increase stroke volume, you increase cardiac output, and therefore you even increase the blood pressure. Also, these hormones are responsible to increase motility in the digestive system. They are responsible in formation of axons in the nervous system, and therefore are responsible to maintain alertness of the person. And also generally, these hormones increase the responses of what we call the sympathetic nervous system in general. On the skin, they are responsible to maintain blood flow in the skin, and therefore if you increase blood flow and nutrient supply to the skin, then you're also affecting hair growth. On the bones, they are responsible to increase maturation, okay, and growth of bones. Briefly about regulation, we said that the hypothalamus produces what we call TRH, thyroid releasing hormone. TRH goes to the pituitary gland, to the thyrotropes, and encourages production of TSH, thyroid stimulating hormone, that comes to the thyroid gland, to the follicular cells, received by TSH receptors, and leads to the production of T4 and T3. So with that brief understanding of the thyroid gland, let's dive into the hypothyroidism, okay? We are going to look at the pathophysiology, the signs and presentation or clinical presentation. How do we diagnose and then how do we treat people with this condition? We have what we call the primary causes and the secondary causes. Primary causes are basically the causes or are basically the things that affect the thyroid gland itself. And secondary causes are causes that are somewhere else, not on the thyroid gland itself. The first one, and maybe the common one, is what we call the Hashimoto's, okay, or Hashimoto's disease. What happens in Hashimoto's is that this is an autoimmune disease that leads to production of antibodies that affect the thyroid gland itself. This is different from Graves' in that in Graves', the antibodies that are produced in Graves' disease actually amplify the functioning of the thyroid gland. They stimulate TSH receptors and leads to increased production of thyroid hormones. But in Hashimoto's, the antibodies, okay, that are produced actually lead to destruction, okay, destruction of the thyroid gland, and therefore leads to reduction in T3 and T4. Now, other things that can affect the thyroid gland, we have viruses. These can also attack the thyroid gland and destroy it, and therefore makes it incapable of producing these hormones in their large quantities. Then also we have some drugs, okay? One of the common drugs that can easily destroy the thyroid gland is lithium, okay? So these things can destroy the thyroid gland and therefore lead production of its hormones. Secondary causes can be an adenoma or a tumor in the pituitary or in the hypothalamus. So in other words, anything that can affect, that can lead to reduced production of hormones from anterior pituitary gland or from the hypothalamus, they can also lead directly to reduction in production of the hormones of the thyroid gland. Because remember we said that the thyroid gland is under control of the hormones from the hypothalamus and also the pituitary. Meaning if there is anything that leads to less production of TRH, it will also lead to less production of TSH and therefore less production of T4 and T3. Okay? Then also another common cause is reduced intake of iodine. Most of the common sources of iodine, we find that we get it in foods like eggs, in seaweed, and seafoods. But in cases where you find that someone has less intake of iodine, it means that there is going to be less iodine that is required for formation of these hormones. And as a result, someone is going to have less hormones T3 and T4. This is also common in some places whereby you find people have less iodine in the foods that they eat. And therefore such people get what we call geographical goiters, okay? The thyroid gland is overworked and therefore someone develops a goiter. All right, let's look at the signs and symptoms. How does someone with hypothyroidism present? Okay. So, we are going to discuss this in relation to the effects of these hormones. Because basically what happens is that when you understand the effects of these hormones, it means in hypothyroidism, these effects are basically going to be reduced. Okay? So, meaning we are going to have less lipolysis, okay? less glycolysis, less everything, and as a result, someone is going to have decreased metabolic rate. And we said as you decrease the metabolic rate, of course, you're going to decrease even heat production. Okay? Heat production. So, someone is basically going to become what we call cold sensitive. So someone is, because already there is reduction in heat production, so someone does not want to be in cold environment, okay? And also, because of reduction in glycolysis, reduction in metabolic rate, these people normally gain weight. Okay? On the heart, we said that these hormones are responsible to increase heart rate and the force of contraction. So what is going to happen is that you are going to have a reduction in heart rate. And therefore, this person can have what we call bradycardia. Okay? Also, a reduction in force of contraction means you have reduced the stroke volume, and therefore you have reduced the cardiac output, and therefore we expect that the blood pressure is also going to decrease. But what happens is that these hormones also, their reduction causes what we call vasoconstriction. So, a reduction in cardiac output, but you have increased vasoconstriction. This counteracts the effects of blood pressure. And therefore, normally we find that we do not have really a significant change in people of hypothyroidism as far as their blood pressure is concerned. Digestive system, we said they are supposed to increase motility, and therefore these people are going to have reduced motility. And this can easily translate to constipation. Okay? Then we also said on the nervous system that these hormones are basically supposed to increase the effects of sympathetic nervous system. So their reduction, of course, reduces the effects of sympathetic nervous system, and therefore, this person, one, they are always sleepy. They sleep too much and they are less alert. Okay? On the bones, so there's going to be reduction in bone maturation and growth. And as a result, this person can become a dwarf. Okay? Skin, we say they are supposed to increase blood flow in the skin, and therefore there's reduction in blood flow, and therefore reduction in hair growth. Actually, in some cases, you find that even the hair starts to they develop kind of alopecia. Okay? All right. So, these are some of the signs and symptoms that someone with hypothyroidism is actually going to present with. Let's look at diagnosis. How can we diagnose someone with hypothyroidism? In this case, we are going to do what we call thyroid functioning tests. These tests basically look at what we call free T4 and TSH. So in this case, because we say we have primary and secondary causes, in primary causes of where the effect is or where the problem is actually with the thyroid gland, you find that there is less free T4 hormones, but then TSH is actually high. Reason being that when there is less T4 in blood, this information goes back to the pituitary gland and says, look, there is less T4 hormone in blood, and therefore increase the production of TSH so that you stimulate the thyroid gland to provide more of the T4. But because the thyroid gland is ineffective, you find that this hormone is not going to respond. And as a result, it means you are going to overwork the thyroid gland, and as a result, someone is going to have a goiter. Okay? Then also in secondary causes where maybe the problem is with the pituitary, you find you have less of TSH. Okay? And now this is not affected. All right, lastly, how do we treat people with hypothyroidism? Normally, these people get what we call exogenous hormones. Okay, so these people are injected with already manufactured hormones, and most of the times manufactured T4 hormones. So one of the drugs that is available on market is what we call levothyroxine. So these people are given levothyroxine, and also depending on the cause, maybe if the cause was reduced intake of iodine, then you can increase the intake of iodine, and therefore the condition can actually be reversed. All right, so if you have watched up to this step, please consider subscribing to our channel so that every time we upload a video, you are notified and therefore you do not miss any of our videos. Thank you very much.